From the Detroit Free Press, it's Monday, January 25th. Here are today's top stories, presented by Bush's Fresh Food Market. Calling all foodies, Bush's is hiring. Are you passionate about food, looking for growth, development, and excellent wages? Come grow with Bush's and apply online at bushes.com/join our team. That's Bush's, BUSCHS.com/join our team.
For the Detroit Free Press, I'm Kerry Jr. II. A COVID-19 variant has been detected in Michigan. The B117 coronavirus is said to be more contagious, and it may adjust how health officials approach vaccination moving forward. Free Press reporter Kristen Jordan-Shamus has all the details. Thank you again. Always a pleasure to speak with you.
It's great talking with you today.
Can you tell us a bit about what's going on over there in Ann Arbor and the details surrounding that?
Absolutely. So what we know is that 3 women in Washtenaw County with links to the University of Michigan are confirmed to have this more contagious mutation of coronavirus called the B117 variant or the United Kingdom variant, because that's where the first case was identified back in September. And we also know that 5 more people have tested positive for coronavirus who were in close contact with the first known Michigan case of that UK variant. But health officials haven't been able to confirm that those 5 other people also have the variant because it takes genetic sequencing of their coronavirus tests, and that's a really complicated process that can take 5 days to a week to complete.
Let's back up a little bit. How did the first case of the variant get here?
So she flew to Michigan from the UK on January 3rd, and she had a coronavirus test before she got on the plane, and that test was negative. She also had negative coronavirus tests on January 4th and January 6th, but on January 8th, she got a positive test result. And then it turns out that 2 other people who live in connected households also ended up contracting the virus, and their genetic sequencing showed that they had the variant too. And now all of them are in quarantine.
There must be some type of protocols the school is going under to ensure that, other students at the school aren't getting this.
Yes. So the University of Michigan said all of the close contacts of the women who've got the UK variant have been identified. They've been tested, and they all are in quarantine. And the university is also recommending that all the students, graduate and undergraduate in the Ann Arbor area, even students who are taking classes remotely, it's recommending that they get weekly coronavirus tests so that cases can be identified quickly and they can be contained fast. And they say that testing is really important for people who live in large groups, like in residence halls or fraternities, sororities, or co-ops. It's also really important for people who traveled recently. So any student who returns to the campus or the Ann Arbor area is asked to schedule COVID-19 testing within 72 hours of their arrival.
So they've got a plan for how they are wanting to attack this specific issue, but this variant now is something different from some of the other strains of COVID-19. Can you tell me a little bit about why it's different and why this is some news?
This strain isn't necessarily deadlier, but it is way catchier. So it's about 1.5 times more transmissible than other variants of the virus. So it spreads about 50% faster. It just raises the risk of more exponential spread through a community. And then, of course, with more people getting sick with COVID-19, you end up with more people in hospitals and then eventually more people dying.
Yep, the best way to reduce the number of deaths is to reduce the number of people who actually catch the disease. And so that does alarm us just a little bit to know that this is something that is catchier. But we do have vaccines that are on the market. Do those vaccines also work with this variant?
They do, we believe. The research is still ongoing, but all the data that's been collected so far suggests that both the Moderna and the Pfizer vaccines do work with the variant. It's important for people to keep in mind that though we've identified these cases in Washtenaw County, there's still a pretty good chance that this form of the virus, this very catchy strain, could be circulating elsewhere in Michigan. And that's because it's already spreading throughout the United States. It's been detected in at least 19 other states, 144 total cases so far confirmed nationally, and that's according to the CDC. So there's a chance that there's other people who have this variant as well. and we just haven't identified those cases yet. What epidemiologists are saying is that it will also take a higher proportion of the population vaccinated to get to herd immunity. Before, the state epidemiologist, Sarah Lyon Callow, was saying that it would take about 70% of the population ages 16 and older to be vaccinated to reach herd immunity. Just earlier this week, she said it could be 90% or more of the population would need to be vaccinated to get to that point with the new variant spreading.
Free Press reporter Kristen Jordan-Seamus, thank you so much, as always, for your insight.
Thanks for talking to me today. Take care.
You too. Since speaking with Kristen, 5 cases of the B117 variant have been confirmed in Washtenaw County. And on Saturday, state officials said a Wayne County man also tested positive for the virus. Here are the latest coronavirus numbers. As of Saturday, the State Health Department reports 1,600 cases of the coronavirus and 221 deaths. About 1,800 cases and 70 deaths have been reported over a 7-day period. In total, the health department has reported over 548,000 cases and over 14,800 deaths since March. For more information on COVID-19 in Michigan, head to www.freep.com.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. If you're a fan and want to support our quality local journalism, subscribe. Go to freep.com/special offer.